Hi, Dr. Lairmore. Good afternoon. I'm Esha, a high school student who is interested in being a veterinarian. I'm really thrilled to welcome you to the interview series on the careers of veterinarians. Thank you so much for joining us.
It's my pleasure to be here, Esha, and thank you for allowing me to say a few words today.
Let me start with an introduction of our speaker. Our speaker today is Dr. Michael Lairmore. He completed his DVM from the University of Missouri. After working as a dairy and small animal veterinarian, he completed a residency and Ph.D. in pathology at Colorado State University and a postdoctoral training from the CDC. He is board certified in veterinary pathology, virology, and immunology. Dr. Lairmore is the past dean of the University of California Davis School of Veterinary Medicine, which has the #1 ranking among veterinary schools and colleges by the U.S. and U.S. News and World Report. As the dean, he oversaw all School of Veterinary Medicine, teaching, research, and service activities, personnel, facilities, and funding resources, and presided over 6 academic departments: Veterinary Medicine Medical Teaching Hospital, the California Animal Health and Food Safety Laboratory System, the Veterinary Medicine Teaching and Research Center, Veterinary Medicine Extension, and numerous centers of excellence. Dr. Lairmore has helped create new clinical trials infrastructure, student services, research, global health, and diversity programs, and promoted a culture of philanthropy, communications, and innovation. He is one of the few veterinarians elected as a member of the National Academy of Medicine. He is also a fellow of the American Academy of Microbiology and the American Association for the Advancement of Sciences. He has received numerous teachings and research awards through his career. He has authored or co-authored 190 scientific publications and has provided significant breakthroughs in the biology of human retroviral-associated carcinogenesis. With this introduction, let me extend a warm welcome and thank you to Dr. Lairmore for chatting with me today.
Well, thank you, Esha, and I'm a little bit humbled by that introduction, but I will likely be able to share my screen now.
Yes.
Okay, very good. I'll do that and go a little bit further into what you had just discussed. First of all, I'd like to welcome your audience, and very thankful that they're here and they're interested in veterinary medicine, which is the greatest profession, in my humble opinion. And I'd like to, first of all, maybe just hit a couple of points just to give a little bit of background, some of that which Esha mentioned, but also to go in a little bit more depth. As you see from this personal history, I'm a family man, father of a blended family of 5 children, a son and 4 daughters. The fact that I have 4 daughters, I'm never at need for advice in my life. And let me see if what I'd like to do is start out really at the beginning of my education as a veterinarian. I was very fortunate to go to the University of Missouri and was able to get in school. I studied biology in the arts and science program there, finished my DVM in 1981. During my career at the University of Missouri, I was exposed to not only veterinary medicine and the opportunities there, but also got to do a research project, and I'll mention the importance of that in a minute. I wanted to initially be a small animal veterinarian because I started at the age of 15 and went up to my parents and said I wanted to be a veterinarian. And they had never gone to college, so it was a difficult task for them to guide me. But I did get a job with a local veterinarian, a small animal practitioner, but later in school became very interested in large animal medicine. In part to be able to involve myself in community and public health. And I became right out of school, a dairy practitioner and also small animal. So it was a mixed animal practice. See here a couple of slides from my experience. But that lesson taught me some confidence early on that I could be a clinical veterinarian, as well as the critical role of veterinarians in the daily lives of their community. So that's what I really learned, the critical roles of veterinarians in that time period in private practice. And I think that really helped me mature. I was 25 years old when I graduated, and I think those 2 years in private practice were instrumental in terms of my understanding of public health and the role of veterinarians in the community. Well, had a great opportunity. After my son was born, I decided that I wanted to go on and extend my education, and I was accepted into Colorado State University, as Esha mentioned. And they had a dual degree program, a program where you were able to study for advanced training and a Ph.D., but also do your residency in pathology. And I'd never been to Colorado before, but I enjoyed the experience immensely, was able to begin my career in the study of sheep retroviruses. And I'll mention that more specifically here in a minute. One of the things I had the privilege of doing, and a lot of careers are influenced by their mentors and the people that they meet along the way. I was very fortunate in graduate school. We had a lot of invitations from other scientists, such as Howard Temin, who won the Nobel Prize for reverse transcriptase, Bill Jarrett, who discovered feline leukemia virus, and Peter Dougherty, who won a Nobel Prize for T-cell immunology. All of these sciences influenced me to learn more about science and to extend my career as a veterinarian, but also as a veterinary scientist. Along the way, I became board certified, as mentioned by Esha, in the American College of Veterinary Pathologists. There are a number of opportunities to specialize in veterinary medicine, and I chose pathology because I was very interested in disease and diseases of animals and humans. Later, I became vice president and then president of the college in 2009 and 2010, and got a chance to help at a national level in that particular specialty area. So what are some of the lessons I learned in my PhD training and specialty board training? Well, one, I began to understand the role of One Health, and I'll explain that a little bit later in my presentation, because it really incorporated my desire to learn about mechanisms of disease, but also how to extend that into biomedical research. I was very privileged to get on the ground floor of a study of a virus that later became a model of the AIDS epidemic. And I'll go on a little bit further about that. And also I was able to expose myself to some early leadership chances. My peers asked me to be a leader of the Graduate Student Association, and later that helped me launch my leadership career. So what are lentiviruses? Well, those are viruses that affect sheep, and they can cause chronic wasting diseases, as shown here by this emaciated sheep. And in the laboratory in 1983 and 84, we were studying these viruses. And my advisor came to me one day and showed me an electron micrograph. That's a picture of a virus particle. And he said, "What's that from?" And we all knew that. And we said, "Well, it's a sheep retrovirus." But it was actually from the first AIDS patient. So about the time I was studying in graduate school, the virus AIDS was discovered in humans and was causing similar diseases, immunodeficiency diseases, ones that wreck their immune system. And it was the beginning of a worldwide epidemic of AIDS as we know it today since. But at that point, it was not known that the AIDS virus was a retrovirus or that it was related to our sheep retroviruses. Needless to say, my world changed overnight. I was studying the virus that could be a model for a human disease. As shown here on the right is a sheep lentivirus lung lesion showing the aggregation of lymphocytes that's known for that disease. On the left is a human AIDS lung lesion. You'll see them to be very, very similar. And what we did was developed an animal model then of pediatric AIDS. And from that, it launched my career. So one of the lessons that I learned here was how concurrent events in society can really affect your career path. So while I was studying sheep viruses, AIDS was now recognized as an opportunistic infection, initially in San Francisco, but then throughout the world, as reported here by the MMWR. So if we look at that disease as an example, one of the interesting things about that disease is actually it was well known in the veterinary field. And it was well known because it was studied by people like Bjorn Sigurdsson in Iceland. At Reykjavik University, Bjorn was very interested in a chronic wasting disease of sheep in his country. He was actually an MD, but he was curious. And he developed the concept of slow viruses, or lente. That's the term that is used in Iceland for slow. And he said that because they're slow, chronic, and developed over time. That got me my job at the Centers for Disease Control. By studying a virus that was important in animals and in people, I was recruited by Dr. Fred Murphy, one of my mentors along the way, at the Centers for Disease Control. There, I had the opportunity to develop tests for the blood supply against retroviruses, such as HTLV1, which is a related virus that causes cancer in people. And I began my path of studying these viruses, including viruses from all over the world. One of the viruses that we discovered was a variant in the Guaymi Indian population of indigenous Indians in the Costa Rica area. So a great opportunity that launched my career studying viruses. While at the CDC, I also had the privilege of being exposed to other scientists, including George Bayer, who studied rabies, Robert Gallo, who was one of the first discoverers of HTLV1, and others in the field, including Kary Mullis, who was the discoverer and won the Nobel Prize for the discovery of PCR, which is used prominently after that for diagnostics. So I settled on studying a virus called HTLV1, or human T-cell lymphotropic virus. And what that means, it's a virus that affects the T cells of people, and it can cause cancer, as shown here in the middle, and on the right side, the cancer cells. Well, as it turns out, this virus also has a parallel in veterinary medicine, that is bovine leukemia virus, which is closely related and also causes leukemia and lymphoma in cattle. So from that, one of the lessons that I learned in my postdoctoral training at the CDC was how veterinarians can contribute to the broader field of biomedical research. And working in collaborative groups, such as the Food and Drug Administration, we work to help set up a blood screening for human viruses in the blood supply and using molecular techniques for diagnostics, and also leadership skills. I was promoted to a section chief while I was at CDC and learned how to manage people in addition to being a scientist. Well, a few years later, I was recruited to The Ohio State University. And at The Ohio State University, I started my career in academia. I was recruited there in part because they had already started a retrovirus center there and was a fertile ground for a young scientist studying these type of viruses. It was a large land-grant university with a comprehensive health sciences center, which provided many opportunities for my career. It was there that I also was recruited to be chair of graduate studies in a department that coordinated and allowed the biomedical research training for a number of scientists, two of which are shown on the upper right, and that are Esha's parents, Bindu and Amithraj, who were graduate students in my laboratory. And I was very blessed to have them as graduate students who earned their PhDs with me during that time period. One of the things I learned during that time period was building a student-focused model of education with high standards. One of my students challenged me during that time, Garrett Newbound, to study and become board certified in veterinary microbiology because I was teaching virology and immunology at the time. So I went back and got my boards. And what this tells you is that learning is a lifelong process. So studying the HTLV1 or the Delta retroviruses, I knew I had to find out model systems to help understand the pathogenesis of these viruses. There was a variety available and that to study those. I had mentioned the one in cattle, but also in sheep, mice, and rabbits and monkeys. It turns out the rabbit is uniquely susceptible to the virus infection. It doesn't develop disease, but was a perfect model to understand the pathogenesis of the virus. One of the concerning things about these viruses of retroviruses, in particular HTLV1, it's an infection that once the person is infected, they're lifelong infected. And over the period of time that they're infected, the virus is fairly insidious. It causes lymphocytes to proliferate or divide and to its own end. It's interested in its own replication, but we didn't understand the mechanisms of that. So we began to use different tools, such as molecular clones of the virus, to study the virus. And that is where most of my career was spent at Ohio State studying the pathogenesis of this virus. We used the rabbit model to understand where the virus went in the body, how it replicated, what kind of environment within the host did it need to replicate. This leads to other opportunities for interfering with that infection or preventing the infection. While I was there, I was very fortunate to have a lot of colleagues around me who liked and studied very similar viruses. So at the Center for Retrovirus Research, we formed what we call a signature program, or a group of people working together, all studying the same aspect of viruses. And that was very fruitful and was funded by a feline vaccine royalties that helped get us started. And then later the NIH, the National Institutes of Health. And I'll get back to that later as an opportunity that allowed us to get funding to work together and focus on that virus. And we were able to get a program project grant, which is still in existence to this day. What was interesting during that time period was, again, things that were happening in society during the 2000s. And that included emerging diseases such as foot and mouth disease in Europe, anthrax and bioterrorism, and also concurrently the Human Genome Project. All of these influenced not only the world of biomedical research, but also all of us that were studying viruses. There were concurrent also events such as emerging diseases. This is well before COVID, but in 1994, diseases such as those that caused, eventually was called Hendra virus, but caused severe pneumonia in Australia, led to a number of opportunities for people to understand pandemics and their origins of pandemics in their environment. These are all to say that while I was developing my own focused career on retroviruses, the world around me also was changing. So one of the opportunities that I learned as a faculty member now was the value of high quality instruction for professional students, and also the educational philosophy that they are our students today and our colleagues tomorrow. The relationships and the mutual respect that was built during that time period really established me as a leader and helped me mentor other students along the way. Eventually, I was recruited to be the department chair in 2002. This was also a very rewarding period of my life in that I was recognized by the university as a distinguished scholar and had some of those other awards, including being inducted into the Institute of Medicine, which is now called the National Academy of Medicine. During that time period, I was also interested in helping others in research and was recruited to be the Associate Dean of Research. So a broader role across the entire college. And this really helped me as well. One of the opportunities, because I studied viruses of humans, was I was recruited to the Comprehensive Cancer Center, the Human Comprehensive Cancer Center at Ohio State University. And there I became an associate director for shared resources and basic sciences, extending my network and also my opportunities. Well, flash forward in 2011, I was recruited as the Dean of UC Davis, as Esha mentioned. And this was really taking all of those lessons from my past and to try to respond to future challenges, which is what I'm going to spend the rest of my talk on. These future challenges were well known to me because I realized that during my training, I was exposed to the concept of One Health. That is the interface of animals, people, and the environment. And from this gave me an excellent foundation for becoming a dean of an institution such as UC Davis. The mission of UC Davis, we decided early on in 2011, was to advance the health of animals, people, and the environment. That basically is the definition of One Health. So our entire mission of the school was around this theme. We also wanted to lead veterinary medicine, but importantly, address societal needs. And again, this is a common theme among people that are veterinarians, that they're addressing not only the needs of pets and animals, but also society overall. I mentioned the concept of One Health. This is a concept which is developed not recently, but actually was really a concept that's well over 100 years, if not longer, old, which is the combination of both medical and human fields. But it really involves this interface of animals, humans, and the environment. but it also involves, as you see here, multiple disciplines such as veterinary medicine, of course, but also human medicine, social sciences, engineering, ecology, biology. What that means is that we're seeing problems in our world related to this interface. And what we need is to work across disciplines or transdisciplinary work. We've included that at UC Davis to also include plants, because plants are what we all depend on in this world. And so within our environment, plants play a particularly very important role. So this One Health interface of animals, people, and the environment, you may wonder, well, what kind of things do we see? But you can see from this diagram, if it involved water or plants or animals or the food supply or water security, they all may be influenced by the environment, things around us, such as climate change, cultural disparities in our society, economics, and education. So these come together, and what it really requires is a professional that is able to talk across disciplines, be able to bring people together, and be able to commonly look at a problem such as climate change and health to solve this through the One Health approach.
Thank you for sharing all that information. It was really inspiring and very informative. What do you think the role of veterinary medicine is in our global society? What are some of the opportunities, challenges, and needs in the field?
Thank you, Esha. And yeah, I think one of the talks that I give at NIH and other places, and to groups and conferences about veterinary medicine, is the role veterinary medicine plays in a global society. One of the roles they play may be in industry, like your parents, for example. With that global population and the depletion of natural resources, new pathogens may come up. About 75% of pandemics have been associated with animal diseases. And also in our fast-paced world with the spread of global travel, for example, we've learned from pandemics such as COVID of how fast that disease can cross barriers, or habitat change, things that people have changed in the environment to cause an exposure to a disease. Our ethnic diversity in our society will continue to increase. We need to understand the needs across the entire globe. Political destabilization, right now we're seeing a war in Ukraine, and the cause of that and the outcomes of that affect all kinds of things, including people, animals, and the environment. Global warming, as I mentioned. All of these things indicate the role that veterinary medicine can play in our global society. So some of these opportunities are, for example, veterinarians can help in a variety of ways. One would be food supply. You know, we are absolutely critical to the food supply of the world, research, public health, and other fields. This collaboration with human health is really instrumental in looking at zoonotic disease, or diseases that spread from animals to people, or backwards from humans to animals, and also in the ecosystem environment. So veterinarians are uniquely trained. We're trained in comparative medicine. We train across species. We're trained to understand their environment. So it's natural that veterinarians are really essential healthcare providers, and they transcend species barriers and are critical to public health. Well, this has been recognized and published on in a variety of ways, the critical needs of veterinary sciences. There was a National Academy's report in 2005, which outlined the critical needs of research in veterinary sciences and really emphasized the additional needs for more veterinarians who are trained in public practice. And that would be in a variety of jobs, from diagnostic labs to industry to research. So one of the challenges of our academic side was to ask the colleges to lead an effort to recruit more veterinary students in careers of public health in these various areas that I mentioned earlier. And that is what many of the colleges of veterinary medicine are involved in. One Health and training programs are really common now across the fields. Let me stop there and answer any other questions that you may have.
Thank you so much for sharing all that information. It was very helpful. Could you kindly share the most rewarding aspects of your career?
Wow, that's really hard to put into a single answer. I could go on for the next couple of days, but what I guess I would say making a difference. Making a difference in the lives of animals, of course, is fundamentally what I learned in clinical practice. And as I learned how to help animals, I realized that I was helping people. The pets, we have pet parents that are associated with those. They form a natural human animal bond. The community, animals in agriculture, for example, that they depended upon for their livelihoods and feeding and growing the food supply. But later on, helping people by understanding basic questions in science, such as how can we learn more about a devastating disease that may be an epidemic throughout the world. So I guess the reward is really at the fundamental aspect is making a difference in the world.
Yeah, that's amazing. May I ask, how do you believe the profession has changed during the span of your career, and how have you and other successful professionals adapted to this?
You know, in some fundamental ways, it has not changed because we're trained in the same basic areas, anatomy, physiology, and veterinary school. But in multiple ways, it's changed. I mentioned the things that were going on in society, such as genomics and genetics. Certainly, those have changed dramatically. How we communicate, the internet, the way that artificial intelligence will affect diagnostic decisions in the future. Technology has changed so rapidly, and these get incorporated into all kinds of areas of veterinary medicine, from private practice to areas of biomedical research. So I think that technology changes, the fast-paced nature of our society, the mobility and global changes are all occurring around us. We have to evolve and we have to change with them. And I think veterinary medicine is attempting to do that. So in the training of veterinarians, we also have to train them for what's next, how to be lifelong learners, how to understand how they may adapt over their career, like I adapted in my career to different opportunities that are presented to me. I never dreamed I would ever work at the CDC. When I was a small boy in the fields looking at frogs and toads, I had no idea. I just wanted to know about animals. I had no idea I was ever going to end up as a member of the National Academy of Medicine.
Right, thank you for sharing that. What initially drew you into the veterinary profession?
You know, I think initially it was, as I mentioned, I was exposed to nature. I think that's one of the important things about children, that I was exposed and was allowed to roam some fields, probably inappropriately by myself, but be able to ask questions about, you know, what was that occurring? Why did that animal behave that way? You know, what was the nature of biology? And that curiosity, I think, was the setting for initially getting me interested. And later, as I learned more in my undergraduate training and then as a veterinarian, the world was just a whole potpourri of things that I could learn about life. And one of the things later in our department that I came up with as a slogan was that our life's work is to understand how life works. And I think that became kind of a common theme in my career.
Yeah, thank you. What can high school and pre-vet students do in order to prepare to become a vet?
Well, I think one of the things that helped me in high school, I did get a job as a kennel boy, a super duper pooper scooper, as I was called. And I helped a veterinarian, and he was a very good mentor. And he taught me early on that I needed to concentrate on the sciences, biology, math, to get a good solid foundation in the sciences that allowed me to apply to college, but also to set the stage for more advanced learning later. So I'd say in high school, really following your natural curiosity of where you want to go with your career. And if you find that it is in the area of biology, then certainly veterinarian medicine may be a part of that. You may be interested in animal behavior. You may be interested in how the human interacts with animals, so the food supply. All of these are opportunities that veterinarians have later in life, but it starts with studying science and math in high school.
Yeah, thank you so much for that advice. That's definitely really helpful. For young people like me looking to go into veterinary medicine, what are some things that we should consider before going to vet school?
Well, I think you should start a podcast. No, I'm just kidding. I think one of the things I would recommend is, in addition to the studies in your courses, but also look around for examples of how you might be able to be exposed to veterinary medicine. You're very fortunate because both of your parents are veterinarians, but there are so many opportunities to, it could be through a career fair, it could be through working for a local veterinarian, it could be through volunteer work at the animal shelters. I think understanding how veterinarians work, the different career paths that they have, and then getting involved, both as a volunteer or maybe even as a job, are great opportunities to get that background, and that will count towards your application to veterinary school.
Thank you so much. Thank you so much for chatting with me today and sharing your remarkable experience as one of the giants in the field of veterinary medicine, making a tremendous impact in the field and influencing several generations of veterinarians. It's so inspiring to hear about your career journey, and I wish you continued success.
Thank you very much. And thank you for this time to be able to talk a little bit about the veterinary profession. As I mentioned at the beginning, I think it's one of the greatest professions. It has so many flexibilities and so many opportunities for young people that I hope many more go into the profession. We need you. We need you for the future. We need you for the planet. So thank you for your interest.